All right, let's dive into a topic that affects millions of people but is so often misunderstood: women's mental health. We're going to explore that unique combination of biology, hormones, and just life that really shapes this very distinct journey. So let's just start with the big question right out of the gates. Why is it that things like anxiety and depression hit women twice as often as men? I mean, that's not just a coincidence, right? The answer is, well, it's complicated, and we're about to unpack it all.
So, first up, let's really get a handle on why we're calling this a unique journey and what that actually means for women.
Okay, so what really sets female mental health apart? It's not just about general well-being. We're talking about the specific challenges that pop up from this interplay of hormones, our biology, and what experts call psychosocial factors. Things like societal pressures or maybe caregiving roles. It's this unique cocktail that we're really focusing on.
And this is so, so important. If you've ever felt dismissed or been told your feelings are all in your head, listen up. They're not. They are deeply, deeply connected to your actual biology, to your hormones, and to the real experiences you go through every day.
So, now that we've laid that groundwork, let's take a look at how these unique factors can lead to specific mental health conditions that we see more often in women. I mean, this number really says it all. Women are twice as likely as men to be diagnosed with depression. A single statistic like this one shows you exactly why we need to be having this conversation. It's absolutely critical. And depression is really just one piece of the puzzle here. Women are also affected at much higher rates by anxiety disorders, eating disorders, and some conditions that are tied directly to the reproductive cycle. Things like postpartum depression after having a baby, and PMDD, which is basically a very severe, debilitating form of PMS.
Now, these challenges, they're not static. They change and they evolve throughout a woman's life. So next, let's explore how these different life stages can really impact mental health. A woman's hormonal landscape is just constantly in flux. The whole journey kicks off with those big surges during puberty. Then it continues through the massive shifts of pregnancy, which is followed by this just dramatic hormonal drop after giving birth. And then later in life, the decline in estrogen during menopause can really impact mood all over again. Each of these stages brings its own set of challenges.
Let's just zoom in for a second on one of these stages, that postpartum period. It is so vital to understand that postpartum depression is not the same thing as the baby blues. It's so much more serious. We're talking about extreme sadness, crushing fatigue, and sometimes even having a hard time bonding with the new baby. These are symptoms that need real attention and real care. Okay, so here's how you tell the difference, because it's a really common point of confusion. The baby blues. Think of it as mild mood swings. They don't last very long, and they usually go away on their own. Postpartum depression, or PPD, that's a whole different ballgame. The sadness is extreme, the symptoms are way more intense, and they stick around, and it absolutely requires professional treatment. Knowing how to spot the difference is key.
So knowing all this is one thing, but how do you know when it's actually time to ask for help? That brings us right to our next section, recognizing the warning signs.
So what are those early signals? How can you tell when something more serious is going on? And, maybe it's time to talk to a professional.
Here are some of the key things to watch for, either in yourself or in someone you care about. And notice the range here. It's not just about emotional stuff like sadness. It can also show up as physical symptoms, like being exhausted all the time, or as behavioral changes, like suddenly not caring about your favorite hobbies. The big takeaway here is persistence. If these signs hang around for more than 2 weeks, that's your signal to take action.
Recognizing the signs, honestly, that's the first incredibly brave step. So what comes next? Let's talk about the path to actually finding support and treatment. Look, the whole process of seeking help can feel super overwhelming, so let's just break it down into 3 manageable steps. First, you just have to acknowledge that what you're feeling is real. It's valid. Second, reach out to a professional to figure out what's going on. And third, you work with them to create a plan that's right for you. Thinking about it this way can make it feel a lot less daunting.
So what does a treatment plan even look like?
Well, the main approaches usually include psychotherapy, that's talk therapy, which can use methods like cognitive behavioral therapy, or CBT, to help develop new coping strategies. Then, of course, there's medication, like antidepressants or hormone treatments. And finally, support groups, which can be just an invaluable way to connect with people who really get what you're going through.
And it's so important to remember that professional treatment works hand in hand with self-care. Things like getting regular exercise, eating a balanced diet, and finding ways to reduce stress, these are incredibly powerful tools that really complement formal treatment and just support your overall well-being.
Okay, so we've covered the individual journey, from the biology to the warning signs and treatments, but to wrap things up, let's zoom all the way out. The final question I want to leave you with is for all of us. How can our communities, our workplaces, our families, our healthcare systems do a better job of supporting women's mental health through every single stage of life? Because this isn't just an individual issue. It's a conversation for absolutely everyone.